It is easy to take our bodies for granted. Basic tasks from dressing ourselves to walking are second nature, while simple pleasures like riding a bike and kicking a football come naturally. Now imagine a life where these things don't come naturally, where you're trapped in your own body, unable to move properly or do things for yourself. That's what many children and adults with physical disabilities face on a daily basis. But thanks to our four-legged equine friends, many of these people are quite literally finding their feet again. Hippotherapy is a form of riding therapy that helps people build their core and manipulate their muscles and tap into their inner strength. It can help them learn to walk, move more naturally, and do things for themselves. Originally developed to help people with physical disabilities, it now helps those who have learning difficulties too. This is known as equine-assisted therapy. Hippotherapy is a multi-sensory experience for people who suffer from neurological conditions or injuries, and those with musculoskeletal injuries. The movement of a horse's back in walk actually mimics the human pelvis in walk. The forwards and backwards, side to side, and turning motion exerted on a human's trunk, and the repetition of movement helps to free up the muscles in the spine and build muscle tone. It makes the muscles work in a more normal way, which in turn improves a person's mobility on the ground. Depending on each individual patient's case, hippotherapy might consist of non-conventional riding techniques and exercises performed while sitting on the moving horse or on a standing horse. For example, an individual may need their pelvis to tilt backwards on the horse. They may even lie or kneel on the horse. They might sit sideways or prop themselves up on the horse using their hands, depending on what is trying to be achieved. In hippotherapy, patients don't tend to trot. Walk is the optimum gait to mimic a human's natural walking movement. There can be different paces of walk or walk-to-halt transitions. These sorts of changes in pace will help to activate and develop core muscles. In cases where patients are severely disabled, Louise may perform back riding. She may sit behind the patient on the horse so she can help manipulate the movements. Research has shown that after a course of hippotherapy, the functional ability of people using hippotherapy improves and can then be maintained over a follow-up period. Equine-assisted learning. This uses the interaction with the horse to promote mental well-being. This usually does not involve sitting on the horse, just being around the horse. A relationship with a horse can offer challenges to overcome fears, build up trust, respect, compassion, develop communication skills, problem solving and coping techniques, self-confidence and self-esteem. These skills are transferable to many other areas of ordinary life. Pat therapy. This activity utilises the pony experience. Being around our two miniature Shetlands who are quiet and friendly and love being fussed. Through patting, stroking, cuddling, brushing, this is a highly sensory and emotional experience. Making a new friend can help with confidence, relationship building, communication, social interaction, and promote relaxation and well-being. Whilst the Riding for the Disabled Association, RDA, provide excellent recreational riding for people with physical and learning disabilities, it does not offer the most important element, rehabilitation. Louise is herself a physiotherapist for the Riding for Disabled and offers her professional knowledge to all centres in the area as a visiting expert. Louise's unique skills as a physiotherapist and Pilates instructor, and her equestrian knowledge and training, and being a mum of 3, gives her the expertise and experience in this field. Hippotherapy is a relatively new therapy in the United Kingdom, and Louise is one of only a handful of physiotherapists who are qualified to practice. REACH, the Rehabilitation, Education and Assessment Centre for Hippotherapy, aims to provide a comprehensive service to children and adults with a range of movement disorders, mental health issues and learning disabilities. This service is a not-for-profit organisation and registered charity. It will take into account families on low incomes and benefits, and reduced prices will be offered. REACH aims to offer equality and accessibility to all.